So I'd like to start by thanking the Equalize program for this amazing opportunity to learn and grow as an entrepreneur in a space with some great female colleagues. And today I'm excited to tell you about our company, Cornix, and now we have developed compounds that treat the disease vibriosis. And so I'm going to start by introducing our team. So Dr. Laura Brown and I are professors at Indiana University in the chemistry and biology departments. Doug Dayhoff and Brad King are our company advising team, each with expertise as CEOs, CFOs, or in venture funds. And we're very excited to welcome our very first technician, Chelsea Simpson, who will start in our company lab on July 1. So in order to show you what vibriosis looks like in humans, I have to warn you that the next slides are a little graphic, a little disturbing. So vibriosis is a flesh-eating disease, and that occurs when people contact ocean water with open wounds or when they eat contaminated raw seafood. It has a really terrible morbidity in which wound fatalities are around 25%, and most patients require amputation to stop the disease. So if not treated within 72 hours, death is 100% likely because this infection just moves so quickly. And while I just want to remind everyone that we're in the middle of an antibiotic crisis, and so many of these treatments involve antibiotics, often they result in amputation. And this is actually not a rare disease, so it's estimated at around 80,000 cases per year, which is similar to non-Hodgkin's lymphoma, just to give you a sense of a more commonly known disease. And of these rates have nearly doubled over the last 10 years, and this is especially true globally, where seafood industries are more critical and where people come into contact with ocean water that's contaminated more often. And because of the disease rate, this is actually eligible for FDA orphan disease designation. All right, so and because of the rise in incidences, this was actually a health alert network by the CDC late last year. So Vibrio vulnificus infections are very common, and so that physicians are warned that any wound infection that was a result of an open wound that was near seawater should be treated as a possible vibriosis case. I don't know why my slides are not advancing. Okay. So I'd like to just tell you a little bit about these bacteria. So these are found in coasts and in the deep seas. They're highly abundant. They love salty and warm water. And so when people go swimming in the ocean, again, with an open wound, this is a high rate of infection. And although I really hope I'm not ruining your happy hour today, but people that eat contaminated oysters also are prone to vibriosis through gastroenteritis. And both of these diseases, so the flesh eating as well as the gastroenteritis, are also caused when vibrios infect marine animals. So things like fish and shellfish and even oyster larvae. So why am I telling you about this now and why do we care? If you backpedal about 50 years ago, the water wasn't as warm. We had effective antibiotics and this was more of a rare disease. But obviously now we have global warming that is causing warming of waters that were previously colder. We're in the middle of an antibiotic crisis, and the US experiences about 80,000 cases per year. So just as an example, if any of you live in New York, Connecticut, Massachusetts, these are states that are experiencing exponential levels of increases in cases from contaminated ocean water incidents. And if we then fast forward to 50 years from now, where we know that there's going to be damage from massive climate change that we cannot change in the near future, healthcare crises, and unforetold numbers of this disease. So how do we treat this disease? In order to tell you how our company works on this, I need to back up and give you a little detail about how these bacteria cause disease in humans. Vibrios are really interesting bacteria. They're actually masters of war. They have these arsenals of weapons, really nasty things like hemolysins, acids, biofilms that enabled them to infect so easily and spread in the body. My expertise has been to study quorum sensing, and this is a way that bacteria communicate with each other. And they do this by when they're alone in their environment, they don't actually make all these weapons, but when there's a million of them or a trillion of them around, they communicate with each other and they will launch their weapons and cause the disease. And this is all coordinated by a switch protein, a master switch protein. This is something that we've studied in my lab for 15 years, and we know a lot about it. And this process of quorum sensing is something that happens in almost any bacterial pathogen that you're probably familiar with. Things like strep throat, staph infections, Pseudomonas infections, and things like that. So this has very broad-reaching implications. So what we know is that there are these little binding pockets I'm representing with green blobs in this protein, and our company has developed a panel of compounds that will specifically target these green blobs and bind in the pocket of this master switch protein. And we have over 100 of these. And what we know is that when these compounds bind the master switch, they turn off its activity, they block it from turning on all those weapons, and that is how we block disease. All right, so our platform for Cornix is actually to block bacterial communication. So remember, again, when bacteria are alone in their environment and they can't communicate, they can't cause disease. So our platform is actually to silence this communication. And the panel of drugs that we've developed are actually not antibiotics. They do not kill the bacteria. They rather are we are able to put them on the infection, and the immune system clears the disease itself. And because they're not antibiotics, they're not likely to generate resistance. So let me introduce you to our top compound. This is PTSP. We do have a patent application with PCT filing for both the structure and the method of use. We know this is highly long-lasting, so we can synthesize it and leave it on the bench, and it's perfectly stable. We know it's really simple to synthesize and very cheap, and we have over 20 active compounds to enable different formulations. We know the mechanism of action, so this is a crystal structure of our compound PTSP bound to that master switch protein, and we know exactly how that functions inside the bacterial cell and how it inactivates the function of the protein. And we also know that it's a targeted effect, so this does not harm bacteria outside Vibrios. It only targets Vibrio bacteria, so it won't affect the microbiome, so that healthy skin bacteria or gut bacteria that might be exposed to it. It's also fast acting and it's dose dependent. And so I'm going to show you one set of data that really illustrate the ability of this compound to protect from infection. And so, like I mentioned earlier, shrimp also are targeted by Vibrios and Vibriosis disease. And so this is an experiment with the shrimp, the big ones that we eat. And if we put a bunch of them in a tank and we do an experiment for over a week, they're perfectly happy and they grow and they live and everything's fine. If we give them a single dose of bacteria, they are all dead at day 1. And then, of course, if we give them our compound but no bacteria, they also are perfectly happy and healthy. The difference is if we give them the bacteria, but also our compound, what you can see is that those shrimp actually survive the infection. And this is also dose dependent. So the treated shrimp survive, they're up at the top right corner. The untreated shrimp die at day 1. All right, so this is led us to develop our treatment plan, and so I'll walk you through how this works. We know that in the beginning of an infection, people often have this wound that contacts the water. They may not realize right away the damage that this may cause. Usually by day 2 or day 3, they present to a clinic with redness and swelling, and that rapidly results in necrotizing fasciitis. And if not treated, this leads to very rapidly sepsis, fever, chills, shock, and possibly death. And so there are many late-stage treatments. This, again, is IV antibiotics, wound debridement, and amputation. And what we're proposing is that an early-stage treatment that is more readily available will be able to be applied to these topical and as a topical ointment or spray onto these wounds, and that may be able to prevent the rapid spread of this debilitating disease. And so we're proposing to formulate a cream or an aerosol spray, though, of course, we also anticipate in later stages developing an IV antibiotic treatment in concert with many of these other options. So here's where we are. So we have identified an excellent target. We've ID'd and validated many lead compounds. We have obtained early funding. We've started our market analyses, and we're beginning our proof of concept stage. We started our company in 2023. And so while we have applied for one SBIR, we anticipate that we also want to apply for another NIH SBIR in the future. And so what we need right now to produce and develop these topical creams is we have an ask of $250,000, and this is either money or in-kind contributions for a CRO to do mouse skin infection experiments, to do our PK and our ADMET, MTD, and other studies. We also know we need to scale up our compound synthesis, and these will allow us to develop that topical treatment formulation and do our first in-human studies. And so our current stage is treatment of Vibrio wound infections, but we anticipate in the future moving into Vibrio gastroenteritis. And like I mentioned, this is a disease that widely affects aquaculture. And so places that use shrimp and fish as food sustainability, and in their market, that would also be another market for us. And then broadly speaking, our knowledge and quorum sensing inhibitors as a platform for alternative therapeutics is a future goal. Right. So with that, I'd be happy to take any of your questions.